Welcome back to 3+U. Well, as I'm aging, of course, I'm always concerned about my heart. Anytime I feel like it's beating irregularly, what was that? What was that? Well, irregular heartbeat is a thing, and it can be a life-threatening thing. Here to talk about a brand new, we're going to call it a center at CHI Memorial, is Dr. Gregg Shander. And Dr. Shander, you're a cardiologist. There's more to your title, though. Give me the whole thing.
Cardiac electrophysiologist.
Cardiac electrophysiologist. Okay, all right, that's the only time I'll ever be able to say it right. But irregular heartbeat is kind of your thing, and there's a brand new, I'm calling it a brand new center. It's not a building, but there are 5 doctors just like you focusing on irregular heartbeat. Talk about this new center.
So the Chattanooga Heart Institute at Memorial Hospital has 5 heart rhythm specialists. We are physicians that have trained a number of years to learn how to diagnose and treat heart rhythm problems. And the 5 of us have come together as a team to create this heart rhythm center.
If there are 5 doctors dedicated solely to this, that tells me there's an issue with people's heart rhythm.
Yes.
And it's fairly widespread. What's causing this? What is it? And the title, what? Atrial fibrillation, right?
Right. So atrial fibrillation is by far the most common heart rhythm problem. We think that there may be 5 million people in the country who have it now. Some studies have said there may go up to 20 or 30 million in 20 years. It increases as we age, and it's typically not life-threatening, but it can be very symptomatic, and it can greatly increase your risk of stroke.
So when I think of an irregular heartbeat, I think that's something I would notice. Do most people that have an irregular heartbeat or a heart rhythm issue, do most people know it, or do they just go to get a checkup one day and, hey, did you know?
It happens both ways. So about 20% of the atrial fibrillation is without any symptoms, silent atrial fibrillation. And people go into their doctor's office and they get an EKG and they say, did you know you're in atrial fibrillation? Or they'll listen to their heart and say, your heart's really irregular, let's get an EKG, and that's how they find out. The rest of the population, though, the other 80%, usually know that they have it.
So you mentioned, and this was interesting to me, you said that one of the long-term effects can be a stroke. And when people think stroke, they think the brain. When they think heart attack, they think things like irregular heartbeat. So what's the connection there?
Yeah, well, these things are all connected. So the heart can become irregular. With that, there can become a pooling of blood in the top chambers of the heart. That blood can coagulate, make a clot, and then the clot can travel through the circulation, and one of the places it can go to is the brain. And if it clogs an artery within the brain, that can lead to a stroke.
So if you're having heart rhythm issues, is that something that if you have that issue and it's undetected for a long period of time, can have a negative cumulative effect on your health? Or is it you're just going along and maybe that blood is pooling and suddenly you have a stroke and that's it?
Yeah, again, it can be either way.
Okay.
You can have sudden onset of something like a stroke, or you can just feel bad for a long time. And you can feel bad in a lot of different ways. Some people just get subtle symptoms. I think one patient I had was a really great tennis player, very active, played high-level tennis. He said, gosh, the 3rd set is just getting a little bit tougher than usual.
I would imagine the tired, lethargy, just kind of being always exhausted more than you typically are.
Yeah, it's those sort of quiet symptoms that you say, something's just not quite right. Then on the other hand, we do have patients who know right away, as soon as their heart goes out of rhythm, they feel the heart skipping, they feel dizzy, lightheaded, they sometimes will get some chest discomfort, and just more overt symptoms.
So I know people out there, and I know me, and if I'm just a little tired, a little dizzy, I just need to go lay down. I just need to go lay down. And maybe I do just need to go lay down, but at the same time, I think those are a lot of famous last words also, aren't they?
They can be. So I think you do have to pay attention to your symptoms. It's not always the heart when you feel tired, obviously.
Yeah.
I mean, there's so many things that can do that. But it is a good idea to keep a check of your heart rhythm. There are many ways to do that. They have the new Apple Watch that's out that kind of gives you heart rhythm strips. They have something called.
Do you recommend? Is that fairly accurate? Just doing it on the Apple Watch. I mean, I know it's not. If I'm not going into your office and you're going to pull out an Apple Watch and strap it on me, but
Right.
is it a reliable way to check that, or do we put too much faith in that?
No, I think it actually is fairly reliable. At least it gives you the possibility that it could be
Right.
something like atrial fibrillation.
And you were saying that it's not necessarily genetic, can be, but not necessarily genetic, which I kind of always thought that an irregular heartbeat was. Talk about that.
Yeah, I mean, there are some cases
it?
that are genetic, but a lot of things are the same things that keep us healthy are really the same things that would prevent atrial fibrillation.
Okay, so it's another result of some negative lifestyle choices.
That's right. I think
Okay.
if you don't pay attention to your blood pressure, if we get a little bit overweight, if we're not sleeping well, these are all factors that can lead into atrial fibrillation.
Just described my life, doctor. You just described my. It's so sad. We'll talk about the treatment. I'm assuming a pacemaker is probably the most common treatment, or is it curable, where you can fix it totally?
I don't think we would call it curable, but we do have treatments. Now, usually it's not a pacemaker. That's a little bit more for
Okay.
slow heart rhythms, and atrial fibrillation tends to be a faster heart rhythm. There are really two types of treatments to try to keep people in rhythm. One is medications, what we call antiarrhythmic drugs, and they can be effective. They can have side effects. So it's one of those things where you have to discuss that with your doctor. But the other way, and something that's gone on for about the last 20 years or so, a little over, has been radiofrequency ablation. And what that is where we can go up inside the heart, focus on typically an area in the left top chamber, and make a little cauterizing burn with a catheter that delivers electrical energy and essentially redirect the electrical traffic.
I feel like I'd rather have the medicine. When you mentioned cauterize, the whatever, I'd rather have the medicine, but it sounds like much fewer side effects going that route.
I think, yes, I would say much fewer side effects, a little bit more upfront risk, although I would not consider it an especially risky procedure, and actually a little bit more effective, sometimes a lot more effective than medications.
Well, let's get people to you. Doctor, thank you so much. Again, it's a brand new Heart Rhythm Center, CHI Memorial. You guys are doing it. You want more information on the Heart Rhythm Center? I think like this may be something that, you really need to look into. You've been getting unusually tired lately. You've been experiencing some of the symptoms that Dr. Shander was describing. Give them a call, 697-2308. Who knows, might even save your life. Dr. Shander, thank you so much. We're going to take a quick break and have more 3+U right after this.